always been wait for the cow to fall sick, come in, treat it, get paid, go home, wait for it to come sick again. And this trend tends to avoid us focusing on the non-infectious diseases, because we are so focused on the disease such that the disease must happen before our intervention comes in. And going forward, we need to be able also to discuss with the farmer about what we call metabolic disorders or metabolic diseases, because the farmer is pushing for more production. And as long as we are pushing for more production, we are pushing for improvement of the genetic makeup of the animals. And if we are pushing for genetic makeup improvement, then we must be able to deal with what comes in terms of biochemical reactions, energy demand, protein demand, what we are calling mineral demand, and see how we can be able to deal with these things. We are having a very high uptake of non-infectious diseases, and I think every now and then we need to be able to remind ourselves about non-infectious diseases, because whenever we go to a farm, we are focused on seeing a disease and treating it. And then the farmer has to get in this loop whereby we have the animals getting to the clinical signs, which might take 2 to 3 days. Then the disease now is manifested. You come in, you treat. Before the animal recovers, it's another 7 to 10 days. That is the production loss the farmer keeps having. That is the problem what we are having. Most of us who have been able to practice out there know, if an animal comes down with mastitis, if that cow was producing 30 liters, before the farmer realizes it's mastitis, what will have happened? Low production, low feed intake, until the milk now starts to become what? Clotting is when the farmer will be able to call you. By that time, the disease has already been able to manifest itself, and by that time when you come in with your antibiotics to treat it, maybe the farmer has even tried some antibiotics which have not worked, and this may take up to a month. The one thing that we are sure of is production never goes back to the 30 liters that was there initially, because of that recovery phase. And that recovery phase is where the farmer is having losses. And this is what we need to sort out by discussing metabolic disorders, man-made diseases, production diseases. So metabolic disorders are not infectious diseases. They are non-infectious diseases. A metabolic disorder is an infectious disease caused by the disturbance in normal biochemical pathways responsible for metabolism. Normal biochemical pathways responsible for metabolism, especially around the carbohydrates, the fats, the proteins, and the minerals. This is a very busy slide, but it's very important in the introduction phase so that we can be able to understand. During the transition period is sometimes 3 weeks pre-calving, sometimes 3 weeks post-calving, and this is a very important time in a cow. Those who deal with poultry, which is the most important time in poultry keeping, which is the time that the farmer should actually watch out, which is the time you advise the farmer to ensure that they are there during poultry keeping. Yes? Brooding. That is very right. Then now, in the dairy sector, or when you are doing the large animal, the most important time, the most crucial time, the time that decides how the future animal is going to be, or how the production cycle is going to be, is actually what we are referring to as the transition period. And the transition period is that pre-calving and that period post-calving. Changes happening during that time might actually lead to a normal cow that produces 30-40 liters go all the way down, and also might lead to the newborn calf either dying or surviving and being healthy. So the most important period is the transition period. And that is when the farmer needs to be around the animal, and that is when you need to be able to advise the farmer. And that is why we are saying there's a sharp physiological, nutritional, and hormonal changes during this time. Because the cow is just waiting to give birth, there's a lot of changes in the hormones, and there's a lot of physiological changes in terms of the feed and the energy requirement in an animal as the cow prepares for the onset of lactation. The second paragraph is that milk fever is often the first and the most important metabolic disorder. We are going to touch on all the metabolic disorders one by one, but it's of great importance for us to note milk fever is a gateway disease. Gateway disease in the essence that if a cow develops milk fever, the chances of all the other metabolic disorders coming into play are very high as compared to an animal that starts with mastitis. So during calving, if you end up with an animal that has milk fever problem, you need to watch out for ketosis. You need to watch out for abomasum displacement. You need to watch out for metritis. You need to watch out for mastitis, because milk fever is a gateway disease to all the other metabolic disorders. That is what the second statement is trying to say. And then the third paragraph is because the resulting muscle weakness and impaired uterine contractions predisposes the animal to secondary metabolic conditions. So what all this statement is saying is that metabolic disorders are of great importance, but milk fever is a gateway disease to all the other conditions. So if you control milk fever, there's a chance that you'll actually not end up with mastitis, you'll not end up with abomasal displacement, you'll not end up with metritis. Major metabolic conditions in an animal, as you can see, we have hypocalcemia, milk fever. It's also called what? Which is the other name for milk fever, apart from hypocalcemia? Kuna jina ingine? Parturient? Parturient paresis. The one reason you should never miss out on an answer is because you do not understand the question. That is one of the things our lecturers told us. So whenever you had a question and you do not understand the vocabulary used, he always told you, come and ask. Because the worst that can happen is you miss answering a question because you do not understand the question. On the other hand, we had lecturers who wanted to show you they are very bright. So they will teach you milk fever, hypocalcemia, but in the exam they will ask parturient paresis. And then what do you say? We were not taught this. And they make sure they don't mention parturient paresis. And that is what comes in the exam. And then later, after everybody has gotten a 0, they come, they are very proud and they tell you, this is milk fever. So it's good to know the other synonyms of milk fever. So hypocalcemia, milk fever, is an issue of low blood calcium if we don't want to complicate it. What is happening is that there is very high demand for calcium. Why is there high demand? Colostrum is filled with calcium, milk is filled with calcium. The animal needs more calcium than the calcium that has been oscillating in its body. And this happens because in a day the calcium requirement in an animal is around 10 grams. When the animal calves down, it requires around 30 grams. And the question is, where am I getting these 30 grams? And I need it right now. So it's an issue of onset and it's an issue of immediate. That is the problem we are having with hypocalcemia. Then we have ketosis. Ketosis, again, without getting into it further, we will dive into it, is an issue of negative energy balance. The animal requires this number of kilojoules, this number of calories. What it is getting is this number, there is this gap. And that is negative energy balance. Where do I get this gap from? And you end up with ketosis. The third one is fatty liver syndrome. Fatty liver will always follow up after ketosis. It will always follow up after hypocalcemia. Because of that strain, because of the ketone bodies, we will discuss it further. Rumen acidosis, again, this is grain overload. We have always told the farmers the importance of balancing the feed. What percentage of feed should be given to an animal? To a cow, an ideal dairy cow? What percentage of its body weight? How do we calculate the amount of feed to give an animal? How do we calculate the amount of food we eat? I think that would be a better ideal question. How do we know how much food we need ourselves? What is it based on? Ama ni tumbo ikijaa. Tumbo ikijaa ndio inaamua. A very wrong way of doing it. You know, we are scientists, so we need to base everything on that. So you need to know what percentage of the body weight of a cow it should feed on. I'm talking about rumen acidosis because it's a very common disease, especially whereby we have exotic dairy cattle, which are actually promising to produce so much milk, and the farmer realizes that they need a lot of energy, they need a lot of concentrates, so the cow is supposed to feed 3% of its body weight. Just know that, 3% of its body weight. If the cow is 500 kgs, 3% of dry matter. I insist, 3% of dry matter. So how do you calculate the dry matter? Another problem. So you need to be able to know this. What you will find the farmers doing, especially those with the exotic breeds, to end up with rumen acidosis, is that if the cow is supposed to feed on 3% of its body weight, and this is dry matter content, and they calculate and they end up with the farmer, this cow should be feeding on maybe 50 kgs of feed, or 35 kgs of feed, you'll realize that because the farmer cannot access enough fodder because of the dry matter content, the fresh fodder, the Napier grass, is around 12%. 12% if it is given fresh. If you let it wilt, the dry matter content increases. Silage is around 33 to 35%. Mtaka tufanye hiyo hesabu. Hebu fanya 3% of 500. Umepata ngapi? Yes? 15. That is 15 kgs of dry matter. But imagine the feed you are giving is actually fresh fodder. Fresh Napier grass. Na tumesema Napier grass iko na what dry matter? 12. So take 15, multiply by 100 and divide by 12. Nakuja ngapi? Yeah? 125. That is one farmer. The other farmer was feeding their animals on silage. So take 15, multiply by 100 and divide by 35. Because the dry matter in silage is around 33 to 35. Yeah? Gapi? 42. Yes. So the farmer feeding on silage is feeding on 42 kgs, while the farmer feeding on fresh fodder is feeding on 125. What's the capacity of the stomach? It's also a limiting factor. You realize where I'm going? So to ensure that I get the 42 dry matter, the animal needs to end up with the 15 kgs. Sindio? Dry matter. The question is, the feed you are feeding and the dry matter it has, and you have to work around that. So farmers have realized that it is easier to get to the 15 kgs dry matter by feeding more concentrates than fodder. Ukienda Githunguri, this is a very common problem. So the farmer knows. So the farmer will give 10 kilos of concentrates, alafu kilo 5, you divide, multiply by 100 na divide by 12, alafu atafute maja. And then now the animal is there, and you end up with a lot of problems, especially around rumen acidosis. Remember, in this feeding, as you feed that 15 kgs, how much of it should be fodder? 60%. Nani amesema hiyo? Yes. 60%. So out of these 15 kgs, at least 60% must be forage because of fiber. Sawa. So when the farmer now does it the reverse, when nimesema, so they feed 10 kilos of concentrate, then these are the challenges you are going to have. Grain overload and a lot of problems. The microbiotics in the beneficial microflora in the rumen will go down, and this cow is going to end up with the endotoxins, histamines, and what are you going to end up with? Laminitis. Laminitis. Problem of inflammation of the lamina. So this cow is not standing, but it is producing a lot of milk. We have had that challenge more times than not, especially around those areas whereby there is no enough fodder. So we need to be able to talk about that. Then we have the retained fetal membrane, metritis, displaced abomasum, and mastitis. The first metabolic disorder is hypocalcemia. It's a gateway disease. We have discussed this. It is basically an issue of calcium. And during the calving period, dairy cows have an extreme sudden demand for calcium due to the initiation of lactation. When the animal is calving down, there is that spike, there is that need for more calcium. And the question is, where is this calcium going to come from? And this calcium is not being asked for in the evening. The cow wants the calcium now, and as I've told you, that is where now the problem starts. This creates a situation where mechanism of calcium homeostasis are under great stress, support the cow, and the normal calcemic levels are around 1 millimoles per liter. That is normal, 1 millimoles. Around 1.5 millimoles per liter is normal. And now the problem starts when you go below that. And when you measure the levels of calcium in the blood, and they are below 1.5 or 1 millimoles per liter, then the cow is in a state of hypocalcemia. You can still have a state of hypercalcemia, whereby the cow has too much calcium in the blood system. When does that happen? Hypocalcemia. Yes? Immediately after you are treating hypocalcemia, chances are some of us will overdo it and end up putting more calcium or putting the calcium too fast into the bloodstream, and you end up now with the opposite, which is hypercalcemia, which is also a problem. So the idea is the normal calcemia level is around 1 millimole per liter. The lower limit of ionized blood calcium levels is 1 millimole. That is very important. Cows falling below this limit are classified as hypocalcemia, and depending upon severity, they are classified either as clinical or subclinical. And this is the most important bit. The clinical ones are between 5 to 10%. The subclinical animals that have calved down that have hypocalcemia but subclinical are 50%. Wangapi tumetibu ng'ombe ya hypocalcemia hapa? Huko hakuna milk fever? Dairy is not that high, but it's a challenge that we need to be able to understand. You'll realize that if you talk to another group, they'll be able to all raise their hands, especially where dairy is very big. And imagine that is only 10%. 5 to 10% is where you have the clinical hypocalcemia. The challenge comes in when you have the subclinical, whereby the farmer cannot be able to see the signs. Will the farmer still call you? Will the farmer still call you? And these are the losses now that we are discussing that are hidden, that the farmer is not able to understand where they are coming from, because the animal is suffering, but there are no clinical signs. And we are saying 50% of all animals that have calved down have this challenge. Just to understand this pictorial, that is the cow, and that is a normal calcemia state. The question is, what is happening during calving down? What is happening around the issues of calcium levels? And what is happening here is that there is a signal to the brain that the cow is calving down and it requires calcium. We have said around 30 grams in the bloodstream. And then the parathyroid gland, the brain will send a signal to the parathyroid gland. The parathyroid gland will produce a lot of PTH. And then the parathyroid hormone will be released within the bloodstream. Then the parathyroid hormone will actually go to the kidneys at the distal tubules. Unakumbuka kidney? Unakumbuka kidney? Sio hii ni ya kukula, najua hii mnakumbuka. Ile ingine ya kusoma, ile diaphragmatic. Nani anaweza name the parts of a kidney? The nephrons, the nephews, the distal tubules, the proximal tubules. Haya, wacha tubaki na hii. Iko hapo ndani. So at the distal tubules of the kidney is whereby there is reabsorption of calcium. So the PTH will rush to the kidneys, specifically at the distal tubules, and it will reabsorb any calcium, and it will reduce excretion of calcium, so that there is more calcium retained in the blood, because the animal wants more calcium. At the same time, the PTH will actually be able to go into the intestines. There's a lot of PTH in the body. The PTH will go into the small intestines, into the intestines of the animal, and they will restrict excretion of calcium, and they will reabsorb the calcium. The PTH also is going to find vitamin D, inactive vitamin D in the body, and it will convert it into calcitrol. And this calcitrol will assist also in the absorption of calcium that was in the stomach and in the intestine. At the same time, the PTH will rush into the bones, and this is now where the problem starts. It will rush into the bones, and it will activate the osteoclast to reabsorb calcium from the bone. So there are three mechanisms working at once on the PTH. In the kidneys, we are trying to reabsorb. In the intestines, we are trying to reabsorb. In the bones, we are trying to reabsorb. Because the end result is that the animal wants more calcium. So we are getting calcium from wherever we can find calcium. And that is how that mechanism works. And when all this calcium is pulled in, then you end up with hypocalcemia, because the cow is trying to get this calcium. Remember, this one takes minutes. The reabsorption in the kidneys will just take a few minutes. The problem starts, the reabsorption in the intestines is going to take days. Does the cow has days? It has already calved down. The need for calcium is immediate. And that is why we end up with hypocalcemia. That's when the cow goes down, because even after initiating this mechanism, it is still not getting enough calcium. What are the clinical signs of hypocalcemia? I think there are three stages of hypocalcemia. One is called the prodromal stage. The second one is the sternal stage, and the third one is the lateral stage. The first stage, the cow is still in ambulatory. Ambulatory is whereby the cow can still stand, but it is very hypersensitive. There is excitation. At this level, the cow is bellowing. The cow is bellowing more frequently than not, and the farmer is wondering, you have already calmed down, why are you bellowing? What is happening? At this stage, the farmer might not be able to see much because there's just bellowing, there's little tremors, and the animal is actually hypersensitive. It is just moving around, and the farmer thinks maybe it's just a reaction of calming down. And then the next stage is when the animal is actually showing the clinical signs of hypocalcemia, whereby now we have the dry muzzle. The dry muzzle is a signification that the animal is not okay. Then we have the cold ears. The flanks of the ears become cold. Hypothermia is kicking in. The extremities, the legs, start becoming cold because they are not getting enough blood supply. Then we have the S positioning of the head, whereby the head is actually tilted backwards into the flank, and it's actually an S forming one. And then what you're going to see again is there's going to be bloating. The muscles are not functioning. There's what we call GIT stasis. So the animal is bloating, the animal cannot actually defecate. Neither can the animal urinate because the muscles are no longer now functioning. But it is in sternal recumbency because it still has partial control of its muscles. It has not totally lost the muscle control. So it still has partial control, and it is in that state. We call it obtudation. Obtudation. Obtudation is when the animal is confused. It's a confused state. And you'll end up with an animal in that state. Then we have the lateral recumbency state. This is the third stage. And the third stage, the prognosis is almost grave. In this state, you are not going to do much. It's quite challenging. What is happening here, there is total loss of muscle control. The bloating is extreme, the stomach is up there, the cow has lost all the muscle control, and it is in a lateral recumbency. There are chances that it is starting now to lose even the nerve sense. And in this state, it's quite a dangerous state. Most times than not, the farmer will call you in the second stage, and you can still be able to help that animal. You can see this is the prodromal, when the animal is still able to sit up and it's just trying to position itself, and that is the third stage, which is the most dangerous, when the animal is in lateral recumbency and it has totally lost muscle control. There is bloating, the heart rate goes very low, and the animal is not able to eat, to drink. The muzzle is dry, all the extremities are very dry, and you will not be able to see that animal defecate or urinate. The question is, what can we do to prevent, because these are metabolic conditions, what we want to do is to prevent this disease from happening. Because even if you were to lift this animal and to assist it, there will be issue of production, in terms of loss of production. So both clinical and subclinical hypocalcemia cause a multitude of other secondary events, and reduce production potential in an animal. I've said hypocalcemia is a gateway disease. If it happens, other metabolic disorders are going to happen, and we need to be able to prevent it. Let me just show you this diagram. This is now what shows a gateway disease. What a gateway disease is. It's a start for other cascading events. So when you have milk fever, hypocalcemia, muscle function is reduced. And when muscle function is reduced, rumen and GIT stasis starts. They are not acting normally, and you have reduced rumen movement and GIT. And once you have reduced rumen fill and GIT, then we are going to have reduced feed intake. And anytime the animal has reduced feed intake, because it requires more energy, then you are going to end up with negative energy balance, because the feed is consuming is not commensurate with the energy that is required. And every time you are starting to have negative energy balance, ketosis is going to happen, because if I'm not eating enough food to sustain my normal homeostasis, then I must feed on the fat that I have. And that is why we have that steaming of the animal just before birth, so that if it does not feed enough food after birth, it will actually be able to utilize what? The body fat. Sawa, but we don't want it to utilize the body fat for so long, because now after that you get into ketosis, and also the animal becoming very thin. Again, because of reduced feed intake, what is happening is there is no room and fill. Remember, the animal has just carved down and there's a lot of space in there. And if there is no room and fill, then what is happening is that we are going to have the abomasum get filled up by air, and then the abomasum will lift up, and then we'll have abomasal displacement. Most of us don't understand how abomasal displacement happens. It's when there is no rumen fill. The animal is not feeding, and so the rumen is empty. Do we know the positioning of the rumen? Then abomasum is at the back there, the bottom right. This is where the abomasum is. And then it gets filled up by air, and this pushes the abomasum to the top side. And it's just a question of which side is more empty than the other. And so you'll have the left or the right displacement of the abomasum. And then, of course, there will be reduced milk yield because there is no feed. And on the other side, milk fever will affect immunity. Immune function is affected. The teeth sphincters contraction is not happening. Remember, calcium, magnesium, phosphorus are very important for muscle functioning. And if calcium is not there, then the muscles are not closing as they are supposed to be. And if the teeth sphincter is not closing, then staphylococcus, streptococcus will penetrate in there, and you'll end up with mastitis. Anytime the immunity is compromised, then you're going to end up with metritis. The animal has just carved down. There is a connection now between the uterus and the outside world. This is there's a lot of germs out here, and then they'll actually be able to get back there. The other thing you're going to have is retained afterbirth. If the animal is already in a state of hypocalcemia, as the contractions are pushing, is it able to push? No. So we are not going to have uterine contractions. If we do not have uterine contractions, then we are not going to have a release of the placenta. And then now we are going to have retained afterbirth. And that is where the bacteria now will be able to go back into the uterus. That's why anytime you have retained fetal membranes, after removing, you throw in some pessaries, because we are sure if there was that connection, then germs were able to get into that environment. And that is how you know milk fever is a gateway disease. Incidence rate, this one we have discussed. I've told you what we see is actually 5 to 10%. That is where we have the clinical signs. The subclinical hypocalcemia is the biggest challenge. Subclinical anything is a big challenge, because you can't see it on time, you can't treat it on time. Subclinical mastitis is more dangerous than clinical mastitis, because subclinical mastitis will even go for 3 months. With a cow that was producing 20 liters, doing 10 to 12. So, and then there are other conditions that are coming. But clinical one, the farmer is able to call you for intervention. And that is sorted out, and the animal is okay. But subclinical anything is a big challenge. And we need to be able now to prevent these things before they happen. How do we manage hypocalcemia? There are 2 ways. The first one is during steaming up, we have to do something called negative decad. Negative decad is just dietary calcium and iron difference. What we want to do is push the animal towards metabolic acidosis just before calving, 3 weeks before calving. We want to push the animal towards metabolic acidosis, because metabolic acidosis signifies there's lack of calcium to the brain, and if this happens, the animal is able to start calcium homeostasis early before calving. We need the animal to produce its own calcium, but we need it to produce in the quantities that are required for milk letdown. So most farms, when you get there, what you'll realize is that they will be using the dry mineral leak. One thing about the dry mineral leak is reduced calcium. Si ndio? Tumesoma tofauti ya hiyo na hii nyingine, ama tunasemaga zote tu ziko sawa? Tofauti ya dry cow na chumvi ya maziwa. There's a significant difference around the calcium phosphorus levels. In the dry cow, you'll realize that it has been reduced significantly, so that it can evoke the cow itself to feel like I do not have enough calcium even before calving. And when that evolution is actually pushed, the animal is able to start the calcium homeostasis even before calving down. So that by the time the animal is calving down, then there's already mechanisms in place to produce what? Calcium. And that animal will not be able to go down. But again, we have people also, when you do this dietary calcium and iron, you want to push the cations, the positive ionized minerals more as compared to you want to push the anions more as compared to the cations, because calcium is positive. So you'll find people putting in a lot of sulfurs in the mineral leak so that they can evoke the acidosis. metabolic acidosis. And if this is pushed into the cow before calving down, it makes the cow start pushing for more calcium. And that is why you'll realize that there is reduced uptake of calcium. You'll realize that some farms will even start adding some HCl to a certain level into the feed so that they can keep pushing the levels of chloride up and the levels of sulfur up. And if those two are up within the bloodstream, the animal actually feels like it needs to balance the calcium and the cations and the anions. And during that balancing, it will produce, by its own homeostasis, more calcium. So that when it calves down, there is already enough calcium moving through the bloodstream. And then that calcium will be utilized for milk production. Basically, that is what DCAD is. It is practical, but not so many people are able to do it exactly how it is done, and that is why we always end up with that challenge. And that's why most people will tell you, most experts in nutrition will tell you, we don't have a good dry cow therapy, we don't have a dry, because it's about balancing the cations and the anions, and they need to get something that is able to evoke that calcium production even before the animal calves down. The other way to manage this situation is, of course, through treatment after it has happened. And once it has happened, you treat through intravenous IV, of course, calcium borogluconate. You inject it kindly. I think you're supposed to do it for a certain period of time. Not very fast, not too slow. It should take around 20 to 30 minutes so that you can avoid arrhythmias. And also ensure that you do not put so much calcium that you end up with hypocalcemia. One thing about having treated a cow with hypocalcemia is that we have recurrence. We have a relapse. Why do we have a relapse? Because after infusing the calcium, the brain sends a signal to say, I now have enough calcium. So calcium homeostasis stops. There's no more PTH in the bloodstream. So all those processes we talked about in terms of excretion in the kidneys being reduced, intestines being absorbing of more calcium, stops. And if that stops, it will only stop until the calcium in the blood supply reduces again. And then the whole cycle starts again. And that's why most people will tell you hypocalcemia cases might end up with a relapse a few times, even sometimes two times because of that shift change. One is hypocalcemia, now you have put too much calcium, then now it comes back, it goes below again to hypocalcemia state. You need to find a way to ensure that there's a balance. And if you want to do that, then you have to manage the cow through DCAD. And the other way to manage it is by use of oral calciums. Why oral calcium is because they are easy to absorb, they are slow to absorb, and they'll actually take a little bit longer time than the IV, and the animal is able to stabilize its calcium level to a certain level so that there is continuity of calcium homeostasis by itself. We want the animal to regulate its calcium by itself. So we need to ensure that we do not put too much and ensure that it actually balances at a certain level so that the brain does not signal the lower production of PTH from the parathyroid gland. And we have the oral calciums. One is called Supercal, immediate solution to calcium imbalance. Most of these things I've been telling all vets, if you want to understand a product, just go to the composition at the back, which is something we never do. But we need to start reading what is contained in the product at the back so that we're able to see whether it will help with the problem we have. So there's calcium, there's phosphorus, there's vitamin D, there's vitamin B12, there's carbohydrates. Calcium is the solution to hypocalcemia. Phosphorus is coming in because anytime we have calcium absorption, we must have half of phosphorus. And that is where you see that balance, 1650 and 850. It's very important to make sure that balance is maintained. The other thing we talked about is vitamin D is very critical in calcium reabsorption because of its switch to calcitriol and assisting in calcium homeostasis maintenance. And that is why you can see there's a lot of vitamin D there, that 800 international units. Then we have vitamin B12. Vitamin B12 is a metabolic stimulant. Sometimes I've been able to see around, we are having now butaphosphans, but because all the experts have been asking for slightly cheaper products, so what the pharmaceutical world has done, so that they can give you the product you want at the price you want, and we are all used to butaphosphan being phosphorus, it's in organic phosphorus. But there's something that always comes with the organic phosphorus. It is what? The vitamin B12. So we are having now some institutions removing the vitamin B12. And then you are very happy and you tell me, daktari, unajua, hii ni bei mzuri. That's why I'm saying read the composition. Somebody has removed one element and made the product cheaper. But is it helping the animal? Because phosphorus and vitamin B12 and calcium have a combined positive response to an animal. There's a reason why vitamin B12 comes together with phosphorus and comes together with calcium. So kindly let us watch out for that. My point being, vitamin B12 is very critical when we are dealing with metabolic disorders, and it is very helpful, especially in brain function. Remember, during hypocalcemia, you are going to have some nervous issues. It is very important in nerve resuscitation, brain cell formation, and also red blood cell formation, which means oxygen supply. So kindly, as we look for those supplements, let's ensure they contain what the animal wants, not the price that we want. So vitamin B12 is there for that. Last but not least, we said this animal has stasis of its muscle. Is it feeding? Remember, it can't move its jaws, it can't move its body. Can it still feed? Mastication requires muscle movement. So this product can be used in so many cases, apart from hypocalcemia, especially when the animals require calcium or energy with supercal. You have been able to sort that condition even before it happens. So it will increase milk production, fertility, prevent. We want to prevent the condition before it happens. It will prevent milk fever. Kindly ask your farmers, before the animal calms down, to have supercal, give it to the animal for 5 days, 100 ml, 100 ml, 100 ml, 100 ml, and that animal will not have a problem of hypocalcemia. I hope that is well understood, and that is what the composition does. Calcium, phosphorus, vitamin D, vitamin B12 is very important in anemia state, brain function, and milk secretion. And you can see all these kilojoules of energy. These are very important. These sugars are very important. They are in there infused because we know that animal is not feeding, and that animal requires energy to run its normal homeostasis. The secret to healing, including all the other animals, is first to ensure that animal has what? Energy. Because sick animals or sick people are not eating. And the first thing they need is what? Is energy. And that is why you'll find most of our products are infused with carbohydrates. Even that Solvita has carbohydrates. That Hardex, which is actually for calcium to harden the egg and everything, it has carbohydrates as energy source. When you look at that Vigo Boost, it has dextrose as energy source. When you look at Vigo Chick, for day-old chicks, it has dextrose as energy source. And that is the secret. When you look at force meat, for the chronic respiratory disease, especially in the chicken, most farmers will tell you, I use this product and it worked very fast with my chicken. There is no chronic respiratory disease you can treat in a day. What has happened? The birds were not feeding, but they always drink water when they are not feeding. They always take liquids. So what we have done, away from the phosphomycin in there and the tylosin, we have added 1.6 diphosphate, which is a glucose, which is an energy source. And that is why the birds respond very fast. And the farmer is wondering, kwani hii dawa inafanya kazi namna gani? It is very far away from the infection being cleared. It is only that now you have given them energy. And so Supercal also has energy. The next metabolic disorder is negative energy balance, which is ketosis. The single most important dietary component after water is maintenance, growth, pregnancy and reproduction, lactation, and milk production. This is just a breakdown to tell you what every animal requires and in what order. If today we were all fed with 1,000 calories, the first thing that your body will do with the 1,000 calories, it will allocate energy to maintenance, to maintaining your normal homeostasis. That is where the first energy goes. The second energy will go to growth. If you are still growing, that is what will be allocated energy. The third energy, in terms of food, will be allocated to pregnancy and reproduction. Then if there is still some calories remaining, then it will be allocated to lactation and milk production. This chart here enough tells you that how energy is distributed in all animals. And that is why whenever an animal is not fed enough, I will always use an example of our animals in Ukambani. You know, when you stay in Ukambani and you go to Githunguri, and I know Ukambani and these areas are very similar, it becomes very difficult to advise a farmer. Because in our place, when a farmer tells you, my cow is not coming on heat and it is 4 years old, and you ask them, can I see the cow? You'll be surprised. The 4-year-old cow, the one that is not coming on heat, the one you are trying to go and do hormonal and all those things, it will be which size? Eh? This size. But when you go to Meru and somebody tells you, my 12-month-old Ifa is not coming on heat, it is not coming on heat, there's a problem. Because the animal is. Because if there is no food, the little that I'm eating is going into maintenance. And I can tell you all the feeds that are there in Ukambani is for. So is there any allocation for growth? So that cow stays in maintenance. And that is why they say it remains this way. Because it is just in. And once in a while when it rains and there's slightly more lush grass, then there's an allocation for growth. Do you think there's enough allocation to go into pregnancy and reproduction? So that animal now improves a little bit. It is in stunted growth, but it has improved in height because of the seasonality. But there is no more energy to be allocated for reproduction. And that is why that person will always tell you, my animal is not coming on heat. It has nothing to do with the reproductive season. It has everything to do with nutrition allocation. And that is why an ideal farmer will tell you, after my animal calved down today, in 21 days, my cow was back on heat. Umepata scenarios kama hizo? Whereby the cow calved down today, but in less than 30 days, the cow is on heat. It is on heat because the energy requirement that this animal is getting has surpassed maintenance, it has surpassed growth, it has surpassed pregnancy and reproduction, it has been able now to get in to milk production. That balance is very essential, and that is why we are discussing today negative energy balance. Energy needed for milk synthesis. Blood concentration of glucose should actually be anywhere between 50 milligrams per 100 ml or 60 milligrams per 100 ml. Whenever this blood concentration levels of glucose goes below 25 milligrams per 100 ml, then we are in problems. And that is why we go into negative energy balance. Let me use this chart. I think this will be easier for you to interpret and understand. Let's start with the green line. This is the net energy of lactation. Tumesema we need it to be at around 50 milligrams. Tumesha sawa 50 milligrams. And you can see feed intake here, when the cow is just about to calve down, this is transition period. 21 days pre, 21 days post. And you will be able to see that towards calving down, the cow is calving down at this level, there is decreased feed intake. Why? Hormonal changes, stress of calving down. Is the animal still acting normal? No. Is the animal still feeding the same way it was feeding? No. That is why there is this dip in feed intake. Again, let's look at the energy demand in the cow in the last 3 weeks of pregnancy. You can see it is steady. The energy demand is steady to a certain level. But when it calves down, the energy demand spikes. As the energy demand spikes, the cow is not feeding enough. The feed consumption is going down, but energy demand is high. And that difference is what we call negative energy balance. Because the cow's brain is saying we need more food so that we can be able to produce milk for ourselves and for the young ones. But at this time, the animal is not able to eat more food to even sustain its own running. And when there's that difference in terms of energy, then the animal has to find another place to get the remaining energy. Where does it find the other place to get this energy? Because now the cow is not feeding. It's on fats. So the animal now starts mobilizing its own fats so that it can get enough energy to get this difference between energy demand and feed intake. And that is why we have the steaming up, where the animal needs to be slightly bigger. The body scope needs to be 3 to 3.5. Because when this energy demand shift happens, the cow has some fats that it can be able to metabolize and get some energy from. And that is the definition of negative energy balance. We have many conditions associated with negative energy balance: ketosis, fatty liver, displaced abomasum, infertility, and low milk yield. Again, this is a chart just to ensure that we understand what ketosis is, because I think charts are easier to understand than all those writings. You can see here from the green bit, feed intake does not meet energy demand. We have agreed when the animal is just about to calve down, it is not feeding enough. But what has happened is the signal from the brain is that I need more energy. So the animal already has negative energy balance, and the animal requires more energy because of the demand. There is insufficient ruminal production of propionic acid. We have propionic acid, we have butyric acid, the volatile fatty acid, VFA. Tunazikumbuka? That is where the precursor of glucose comes from the animal. And if we have less propionic acid, then there is not enough blood sugar levels are very low. And they get to below 25 milligrams per 100 ml. And then the low blood sugar makes the animal metabolize fatty acids. This is the fat we were talking about, and the glycerol supplies. So when the animal starts to digest its own fat, then what you end up with is acetyl-CoA. And when you have acetyl-CoA, then there is excess of acetyl-CoA, and then there's conversion of that acetyl-CoA. It is converted into, have these ketone bodies here ending up in the urine and also in the milk. You can actually test the levels of ketone bodies through testing of the milk. And that is where the problem starts, because anytime you have severe ketosis, then you have fatty liver syndrome, which always go together. So in case you wanted to understand what is negative energy balance and what ketosis is this last bit, when now we have a lot of ketone bodies circulating in the urine and in the milk, but it is a result of negative energy balance in a cow that has just calved down. What are the clinical signs the farmer will tell you they are seeing? 1, reduced feed intake. 2, refusal to take dairy meal before forage. This is very common. The farmer will tell you, in the morning, when I've put my cow in the crash and I was trying to milk it, because they always give it dairy meal, they will tell you the cow is not feeding. It doesn't want dairy meal. But the moment I give it silage and all napier grass, then it will come back and feed on the concentrate. And this is very common, whereby the farmer will tell you, ng'ombe yangu imekataa dairy meal. But our answer is always, your kampuni imeharibu dairy meal. Tatubadilishe. Yeah? Naambia bana, sisi kwa hiyo dairy meal sio mzuri. Kuja nikupe dairy meal nyingine. No, you need to ask history of the farmer. You need to ask the farmer, did the cow just calm down? What has been happening? And then you are able to tell the farmer, actually there's no problem with the dairy meal. The problem is we might be dealing with a ketosis problem. Reduced milk production, lethargy, empty appearing abdomen. Remember, the animal is not feeding, so the abdomen looks empty, and this abdomen just calved down. So the farmer can be able to differentiate between when the abdomen was filled up and when it is empty. So they'll tell you, my cow looks as if it has not eaten at all. And then last but not least, the most important clinical sign the farmer will tell you about is the acetone smell. The acetone smell in the breath and in the milk. They'll tell you, my milk is smelling something different. Inanuka kama nini? What is this? Yeah? This guy is very fast on it. Wale watu wa hii mambo ya jioni. Inanuka kama, what is acetone smell? Yeah? Which one? Which one smells like that? Which alcohol smells acetone? Huyu ashaniambia ni pombe. Sasa I want to know which alcohol specifically. Yeah? No, I want to help wenye wakunywi ndio wakanuse, so that they can know what acetone smells like. That is the whole purpose of this. There's an alcohol that smells acetone. So ask the people who go to those joints, they'll be able to tell you. So there's that. It's a good smell actually. It's not a bad smell. It's actually an appealing smell. Some molasses like smell. acetone smell. So you'll realize that in the milk there's that smell, and also in the breath there's that smell. Anytime you find a case of this kind of a case, you've been to a farm, the cow was looking very good, the body condition score was almost 3, then after calving down, you end up with all these ribs showing up, abdomen looks empty, you might be dealing with cases of ketosis. They are actually more than we think. Ketosis is actually the costliest disease in the world, with losses of up to 16.5 billion pounds. Ketosis is very important. It's a silent killer. The animal is not sick. I want you to get this perspective. The animal is not sick. It's only feeding on itself. It's just getting thinner and thinner and thinner, and you're having less milk and less milk and less milk. Tumeelewana? And that is why most farmers will not call you out. They will even feel the acetone smell, and they will still not be able to tell you as a vet, come over and help me. So ketosis is actually a bigger disease when it comes to the losses that it pertains, especially if it is subclinical ketosis, because then even there is no that smell. The animal is only eating on itself and reducing and reducing. And as it reduces, I can guarantee you there's reduced milk production. As the animal gets thinner, is it going to come back on heat? And the farmer will tell you, ng'ombe yangu imekaa miezi 5, haitishi ndume tena. Ni mgonjwa? Hapana, ako tu. Those are the other losses that you have to count, because a farmer needs to get at least 1 calf every year. So again, you are going to get emaciated animal, low blood glucose level, sudden drop in energy intake, high demand for glucose, typical case of negative energy balance. And that is the kind of animal you are going to get. Decreased feed intake, up to 40%. So if the animal is going to decrease the feed intake up to 40%, remember that guideline I told you. It is what? Maintenance, growth. Is it going to get to reproduction? Is it going to get to come back on heat? And that is why the farmer will stay with that animal for so long without actually being productive. This chart is just to show you everything we have been talking about, the mix-up, why hypocalcemia is very important, low feed intake, impaired function, and these problems. It's a cascade of problems. Retained placenta, metritis, all those problems will come anytime you have hypocalcemia or you have subclinical ketosis. How will you know confirmatory diagnosis of whether the cow has ketosis? You check the levels of ketone bodies in the milk. And if the levels of ketone bodies in the milk are higher than 3 millimoles per liter, then you are having too much ketone bodies within the blood. The stipulated should be anywhere between 2 to 3, but if it gets past 3 into more millimoles per liter in terms of the ketone bodies in the milk, then there is a problem and you need to be able to sort it. We have a device for, we actually tried to bring this device to help you diagnose ketosis, but the vets in Kenya are very good in clinical science. So when it comes to confirmatory diagnosis, we are not really into that. So we don't want to spend any money on diagnostic kits. And this is a very big gap that we are having, and I wish it's something that we can be able to discuss and accept and improve on. Our diagnostics are fully relied on history and clinical science. Something like ketosis is something that you can, 10 minutes, not even 10, less than that. I have this device. And every time I go to a farm and I find there's a cow that calved down, I'm able to test the milk. I even have it here and show you how it looks. It's very easy to interpret. And then you're able to confirmatorily tell the farmer, this is a case of ketosis. And then you treat it. But we do not have them anymore because we could not be able to sell as the numbers as we wanted. But this is a device that you can get. It's a helpful device that you can use to test whether the cow has ketone bodies in its system and treat it accordingly. Because 50 to 60% again of the animals that we have, of the daily animals that we have here, actually have a problem of ketosis. Then how do you manage this problem? It's a problem of energy. What the cow needs is energy, give it energy. But the question is in what form? The most bioavailable energy to a cow is propylene glycol. Propylene glycol is just glucose, but in a form that the cow will absorb very fast. It's very bioavailable. So the only treatment for this condition, to prevent and to treat, you need to give the cow energy. And that energy comes in form of propylene glycol. And the propylene glycol will come together with electrolytes so that they can be able to balance the acid-base balance, and then the animal will actually be able to pick up and be able to feed more and be able to convert more. Aids in the treatment of and prevention of ketosis in cattle and sleepy sickness in sheep and goats. Sleepy sickness ni gani? I know you don't have too much dairy, but I can tell you this is one of those products that you can actually use a lot to help the farmers during those drought times. Those animals that go down because there is no enough grass around. What is the solution? What do you give them? How do we differentiate between hypocalcemia and a problem of ketosis or negative energy balance? If the animal is still active. When you have hypocalcemia, there is no muscle control. So whenever those animals go down, those guys in the herd managers tell you, ng'ombe wangu imeanguka chini, lakini bado anafanya nini? Anapinduka, bado anajaribu kutafuta chakula, they are still swallowing. It's majorly a problem of glucose or energy. Ketonex is what could help that animal. So that when it takes the Ketonex, the propylene glycol is energy goes straight into the bloodstream 4 weeks before lambing down. You end up with some sheep going around, turning in circles, wobbly gait, and more times than not, they fall down and they die. Have we ever encountered something like that? It's called pregnancy toxemia. Pregnancy toxemia is a negative energy balance problem. Right now, all the goats we want are the twinning goats. All the sheep we want are the twinning sheep. Sindio? Wakona watoto wawili. The farmer is very happy. The problem is during the last month before giving birth, what will happen is that there's always more demand for energy for the twins. And there's more demand than what the sheep can consume. Remember, there is not even enough fodder for the sheep to eat. And the twins are demanding more energy because in the last bit is when they actually grow to their maximum. And that is negative energy balance. That is pregnancy toxemia in sheep and goats. That is sleepy sickness. When you are called for this case, you find the sheep has already died. When you do a post-mortem, chances are you'll find 2 lambs. Chances are you'll find three lambs. Or you will find two kids. That is pregnancy toxemia. So make it a habit. Whenever you have this big sheep, the doper sheep, and you are thinking they might have twins, ensure that you are able to give them what? Propylene glycol as a source of energy, especially towards the last bit of gestation. And that is what sleepy sickness is. That is what the product contains. This is how you mix it, especially in a big cow. When it is already in ketosis, you need to give it 240 ml twice a day. But if it has just carved down and it's a preventive measure, then you are giving 120 ml per day for a period of 5 to 7 days. If it is sheep and goats, you just give them 30 to 60 ml daily to support that. And I think when you do that, ketosis becomes a problem of the past. Again, we can prevent this disease. We don't have to wait for it to happen. We can preempt that we are going to end up with negative energy balance. So I would rather have my propylene glycol prior and just give it. Again, it is oral, meaning the absorption is slow and it will actually be able to stabilize the energy requirements in an animal. So I trust that is well understood. Then again, negative energy balance. The other point is how do we maintain this high energy? Yes, we have managed ketosis after parturition. And ketosis always happens around 4 to 6 to 8 weeks after parturition. Why is it 4 to 6 weeks? It's because if you did the steaming up well, the cow in the first 1 week, 2 weeks, will be feeding on itself. The cow will be feeding on itself to manage the negative energy balance. Unlike hypocalcemia happens in the first 3 days, 1 to 3 days. It's instant. The calcium demand is instant. The moment the cow calves down, it needs the calcium now. So it goes down in 1 to 3 days. Ketosis is a silent killer because it will happen after the first 2 to 3 weeks. Then from there is when the animal now starts going down. Because that is when you want the animal to have peak production. So after you have been able to stabilize ketosis, the question is, how do I still maintain high energy levels in the animal so that I can continue with peak production for a long time? And that is why you can also use this white energy to assist with that. White energy is just fat. I know the ladies is it the ladies or the enlightened ones? They can be able to tell us. Right now the information is that fat has more energy than carbohydrates. Tunajua hivyo. Fats have more, and actually 3 times energy than carbohydrates. So we have been quite innovative with that information. We have realized that we can actually feed the animals with fat, which has 3 times the energy to maintain their peak production for a long time. And that is what white energy is. It is actually a rumen bypass fat. It is a fat that has 3 times the energy that is not digested in the rumen. So it skips the rumen phase and it goes to get absorbed. And that is why you will not have issues of negative energy balance if you maintain it in terms of production in a lactating cow continuously for the lactating period. So white energy is very important because it is a fat which has more energy, but what is important about it is the rumen bypass bit. That says it is not being digested. Remember tulisema we want to avoid the rumen for so many factors. We still want more production, but anything interfering with the rumen microbes is going to interfere with the production. And this is very innovative because it skips the rumen bypass, and it is coated with calcium, so that now it is not digested. It goes straight into the bomesa and the intestine, and it is absorbed. And if it is absorbed, then the blood glucose levels are maintained above 50 milligrams per deciliter, and that animal will stay in peak milk production for the longest period. This is not a mineral leak. That's why I put it there. There's a confusion between this and a mineral leak. And some of us, when a farmer buys the white energy, you tell them they do not need the mineral leak. This is not a mineral leak. This is a fat. This is an energy source. This is to help peak milk production. The other thing it will help with is the milk density. Holstein Friesians have very low fat, butterfat content. So to increase it, you give it fat. The third metabolic disorder and the last one, I think I'm still on time. So the third metabolic disorder and the last one is retained fetal membranes. Wangapi wetu wame deal na retained fetal membrane? How many of us have been able to remove the RAB? Yes, we have 1, 2. Hao wengine kwani tunatibu nini? Tunatibu nini? It's very important we ask. Usijipate kwa the wrong hole. Unajua kuna watu wengi sana huko. Yeah, retained fetal membrane is a big challenge. Retained afterbirth, I know most of us know it. This is not just a problem of the dairy industry, it's a problem also in the feedlot. And I think for the longest time we have been wondering how can we help the farmer, and this is the failure to expel the fetal membranes within 12 to 24 hours after calving. Anything after the 24 hours is what? Retained fetal membrane, because we want it to be expelled as early as possible. Then we have the pathogenesis of this. Normal placental separation and expulsion should actually take place once we have the uterine contractions and increase of oxytocin and prostaglandin. And then once we have that, the blood flow to the cotyledon. Remember, we have the cotyledon and we have the carancol. And that detachment is what leads to the fetal membrane to be released. So whenever that carancol and the fetal membrane and the cotyledon remain stuck together, then we have a challenge. If you go in there, some of us even try to dislodge it, and then we end up with it being bleeding, which is not correct. We are supposed just to try to slope it off, and if it is not slowing off, what will you do? You should leave it intact. Because if you pull it out, then you cause more harm than gain, because it shows that the enzymatic reaction has not taken place and that separation has not happened. And every time you pull it and you come out with frank blood in your hand, you are hurting the animal more than you are helping it in the name of removing the retained fetal membranes. So ensure that the blood flow has actually been stopped, the enzymatic breakdown has happened, and then the retained fetal membrane is removed. And I don't want to get into all that because my time is almost over. And then the role of metabolic stress during transition period without calving, the cow will experience negative energy balance, hypocalcemia. All those other conditions we have already discussed are precursors for retained fetal membrane, and we might end up having this challenge. I think we have been able to see this. This is very dangerous if it hangs around there for a while because of that connection between the outside and the inside. And there will be metritis after that. There will be pyometra after that. Will this cow still come back on heat within the 60 to 72 days we talk about? No. There will be infertility in quotes, and that is a big challenge. You can see the other one, it is trying to come out, but then it sticks in there because the enzymatic reaction has not happened. There are very many factors that could lead to this. One, nutritional factors. Selenium plays a very important role in the detachment of the cotyledon and the carancles. Two, when we have dystocia cases. Anytime you have a dystocia case, the chance of retained afterbirth is very high. Again, anytime there is multiple births, the chance of retained afterbirth is also very high. Three, infection. Anytime the cow has an infection, either brucellosis, leptospirosis, and IBR, you might end up with retained fetal membrane. 5 or 4, metabolic disorders. If you have treated an animal for hypocalcemia, the chances of retained fetal membranes are very high. If you have treated an animal for ketosis, the chances of retained fetal membrane, again, are very high. If there is stress during calving, especially the first calvers. The first calvers are always anxious, and you might end up with a lot of movement and stress. If there is stress, you might end up with retained fetal membrane. After removing the retained fetal membrane, the animal might not be able to establish its peak lactation, and you might end up with reduced milk production of around 10 to 20 liters. The question is, how do we treat this problem? Of course, the first way of treating is manual removal. You come in, you get in there with your hand, and you pull out. How is the smell of your hand after that? Eh? How is the smell of your hand? It doesn't matter how you wash it. Hata unatumia Dettol, unaosha. What you do is the use of oxytocin hormone, so that you can be able to see whether you can be able to, the cow can be able to push through contractions and so on. But of course, after that, you're supposed to use what we call the intrapessaries, just to clear the infection that could be there. Then the last bit on the management of retained fetal membrane is by use of this new product that has come on board. It's called Utereton. How many of us have seen this product? 1, 2, 3. Only 3 people. Yeah. So Utereton is very new because of that gap that has been there on the retained fetal membrane. Again, we are trying to find non-invasive ways, conservative ways whereby we do not get into the uterus, we do not interfere with the normal functioning of the cow, but still be able to help the farmer remove the retained fetal membranes. So Utereton is a uterine tonic and an metabolic that will be able to tone the uterus and push out and cause contraction using herbal actives. These are herbal bioactives, so this is not a chemical, and push out the retained fetal membrane, tone the uterus, and still help the animal get back on heat. So it's quite new in the market, and I think we are getting positive feedback from most farmers, and I can ask you that you try it and see, especially after calving down, and if you are having this challenge, this instead of going in invasively, because after even you have removed, sometimes you leave a few pieces in there. If they are still attached to the cotyledon, you need to be able to push out. The other thing that needs to come out is the lochial discharge. Remember the discharge that remains after calving down. The faster that lochial discharge comes out, the faster the uterus heals, and the faster there's a signal sent to the brain of the cow to tell it, now I'm ready to receive another fertilization and another calf. So unless the lochial discharge is removed, then you're going to have a challenge. And this product is able to assist with that. So it is a blend of herbal bioactives. It also has a lot of fortified minerals. As you can see, we have selenium, folic acid, and magnesium, which are very important mineral acids. And then we have the herbal bioactives that will help with the removal of the retained afterbirth. It will also help with the initiation of milk letdown. First calvers have a lot of adrenaline in their system, and they may not be able to have milk letdown. You use this product, it will assist with milk letdown. In case you're interested in the composition, there are a lot of herbs to help with the contractions of the uterus. And what I want to interest you in is this bambusa around pain. Not feeding. So if we can be able to help relieve that pain, then the animal can be able to start feeding. So we have a painkiller in there. We have, and also ensures that there's milk letdown. Last but not least, we have selenium, we have folic acid, and we have magnesium, which are very important for milk letdown and ensuring that there is no retained afterbirth. I think That's my 2-hour session. The saturation 200 ml. Then after that, you do 100 ml, 100 ml, 100 ml for 3 days. So one cow requires 500 ml. Wenye wamenitumia wananiuliza, daktari, mbona hujaleta 100 ml? Sasa inaingililia wapi? Na kwa dosage haingii. We are used to having 100 ml. We can only have 100 ml packaging if it fits in the dosage. So a cow will require 200 ml on the first day, then 100 ml on the second day, 100 ml on the third day, 100 ml on the fourth day. That is a total of what? 500 ml. So we can't have a pack of 100 ml. It's not going to help the animal. But we can have it for the sheep and goats. But for this one, especially the large animal, we can't have it. And that is how you're supposed to use it. It's very new in the market. It works very well. Try it with your farms, and you'll actually be able to. The farmer is going to benefit from that. I think I want to stop there. Then we can have now any questions from the two topics. The musca domestica or the metabolic disorders. Who is the moderator?
Asante daktari, can you clap for them? Maswali tuko nayo. So we go and take tea. Okay.
Okay. For me, it's about the Ketosis. And maybe in the usage of Ketosis, some of us have used it and it's really working. But I wanted to know what if, because per day is half a liter, according to 240 in the morning, 240 in the evening. What if someone does it once a day, the next day? Is it okay?
As you have seen, the 240 ml twice a day is when you're already in a state of ketosis. The animal is already in a state of ketosis. It has actually happened. We had a case in Narok during this drought that has just passed, whereby the animals, they could not access any feeds, and the farmer was trying to sustain them using Ketonex, and he was doing a good job. But what we have just said is what they were doing, because they don't want to give the 240 ml per day. Then what they were doing was 120. And so when he called, what he said was, hii Ketonex inafanya kidogo alafu inaacha kufanya. Ng'ombe anaamka, naona ni kama anaenda kukula, alafu anaanguka tena. So until we got into the dosage issue and we asked him, what is the dosage you are giving? You realize the 240 ml twice a day is a calculation of the calories and the kilojoules that a cow requires to maintain its normal homeostasis. And that time we are already into the condition. So it has to be the 240. If you don't want to do that, then do it preemptively. Do it preventively. Preventively, now after the animal has just calmed down and you are giving it, then you give 120. That is okay.
What if you do the 480?
Yes?
I was asking, what if you do 480?
You do? Once a day. No, we do not want to avail all the energy at once. That's why we are splitting the dose. So that you give it in the morning and later in the day for the evening. Because now the 240 is enough energy to sustain that animal for around 8 or so hours. Tumeelewana? So you give it together, it absorbs zaidi. Sawa? And this is just a cautionary measure, so that now the animal can start feeding. And when it starts feeding, remember you can't sustain an animal continuously on Ketonex as much as it's propylene glycol. This is a stopgap measure. So we just want to help it until it actually feeds on enough forage to produce its own energy. And that's why we are splitting the dose. If you give it too much, it will absorb almost all of it. Then again, it will require more energy in the evening. So that is why there is that division. Oh, that's from the online.
Someone is asking from online, does Uteratol have withdrawal period?
Thank you. No, Uteratol is, these are herbal ecbolic bioactives. They do not have any withdrawal period, zero. We are really trying to work around products that can have zero withdrawal period, so that the farmer does not have the loss of milk, and we do not also have the residual effect into the milk and also into our meat. So all those products I've talked about, there is zero withdrawal period. They are management products. You use them on the go as a continuation. And what we are advising the practitioners and the farmers is for you to tell the farmer if they could get the 3 products together as a parturition hamper. Tuko na parturition, tuko na maternity hamper. Yes. So this could be a very good parturition hamper for those highly producing cattle, whereby you give them the supercal, you give them the Ketosis, and you give them the uteratron. There will be no side effects, only better benefits, even if you give the 3 products together, because they are not chemicals.
Thank you, Daktari. Masai tumesonga sana, so we pray for tea and we go down and take our teas. We allow ourselves 20 minutes, ama 15. Ngapi? We allow ourselves 20 minutes for tea, then we come back. Let's give thanks for the cup of tea.